Unlocking the power of sertraline. Uses, benefits and how it works. Are you tired of feeling down and anxious? Are you looking for a solution that can help you manage your mental health? Look no further, because in this video we're talking all about sertraline. This powerful medication, also known as Zoloft, is used to treat a variety of mental health conditions including depression, anxiety, and OCD. We'll be diving into how it works, the benefits it can provide, and the potential side effects. Not only that, but we'll also be discussing important information you need to know before starting treatment with sertraline. So get ready to unlock the power of this amazing medication and take the first step towards feeling like yourself again. Let's get started. Sertraline, also known by its brand name Zoloft, is a medication commonly used to treat a variety of mental health conditions such as depression, anxiety, and obsessive-compulsive disorder, OCD. It belongs to a class of medications called selective serotonin reuptake inhibitors, SSRIs, which work by increasing the levels of the neurotransmitter serotonin in the brain. Depression is a common and serious medical illness that negatively affects how you feel, the way you think and how you act. Depression causes feelings of sadness and/or a loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems and can decrease a person's ability to function at work and home. Anxiety is characterized by feelings of tension, worried thoughts and physical changes like increased blood pressure. OCD is a chronic mental health disorder characterized by uncontrollable, reoccurring thoughts, obsessions, and behaviors, compulsions, that a person feels the urge to repeat over and over. Sertraline is typically taken once a day, with or without food. It may take several weeks for the full effects of the medication to be felt. It is important to continue taking the medication as prescribed, even if you start feeling better. Stopping the medication abruptly can cause withdrawal symptoms. Common side effects of sertraline include nausea, diarrhea, constipation, headache, dry mouth, increased sweating, and insomnia. However, these side effects are generally mild and go away within a few weeks. In rare cases, sertraline can cause more serious side effects, such as changes in mood or behavior. If you experience these side effects, you should seek medical attention immediately. It is also important to talk to your doctor before taking sertraline, especially if you have a history of bipolar disorder or suicidal thoughts or if you take other medications. In conclusion, sertraline is a medication commonly used to treat a variety of mental health conditions such as depression, anxiety, and obsessive-compulsive disorder. It works by increasing the levels of the neurotransmitter serotonin in the brain. Always talk to your doctor before taking sertraline, and be aware of the potential side effects. Remember that it may take several weeks for the full effects of the medication to be felt, and that the results may vary from person to person.